Imagine being on an operating table in the cold, sterile environment of a hospital, your life in the hands of a trusted professional. You're nervous, of course, who wouldn't be? But there's a sense of security, a belief that no harm can come to you under the watchful eyes of those donned in white. Today, we delve into the chilling tale of a man who fell victim not to his ailment, but to a horrifying lapse in professional judgment. His name was John. A man in his prime, he was brought into the hospital with severe abdominal pain. The diagnosis was simple, the solution even simpler: a routine appendix removal. A procedure so common it was practically mundane for the seasoned surgeons. But little did John know this would be his last day. The culprit? Not a surgical complication, not an unexpected allergic reaction, but a fatal error by the very person entrusted with his life. The anesthesiologist, a man burdened with personal issues that clouded his professional judgment, in his distracted state, he made the unthinkable mistake. He administered not just an overdose, but a lethal dose of anesthesia. As John's world faded into darkness, the doctors, the nurses, the bright overhead lights all disappeared into a void from which he would never return. The operating room buzzed with activity, the rhythmic beep of the heart monitor providing a soundtrack to the unfolding drama. It was only after the surgery, when John's still form refused to stir, did the horrifying reality sink in. Despite the frantic attempts at resuscitation, the damage was irreversible. John, who had walked into the hospital hoping for relief from his pain, had instead found a premature end. A simple procedure turned into a nightmare, all because of one doctor's terrible mistake. This story serves as a stark reminder of the immense responsibility resting on the shoulders of those in the medical profession, and the tragic consequences that can ensue when that trust is broken. Doctors are supposed to heal, but what happens when they become the very source of danger? Let's delve into a chilling tale that unfolded over 2 years. In the heart of our story is a respected physician, a man whose very profession was to save lives, yet he unwittingly became the harbinger of a deadly menace. This physician, let's call him Dr. Smith, was held in high regard by his peers and patients alike. He was known for his dedication, his skill, and his warm bedside manner. But the very hands that were meant to bring solace and comfort to the sick, unbeknownst to him, were carrying a silent, unseen killer. Dr. Smith was a carrier of a rare, highly contagious disease. A silent assassin, this disease gave no warning signs, no symptoms to its carrier. It lay dormant, biding its time, while Dr. Smith carried on with his work, unaware that he was spreading a deadly infection to his patients. Over these 2 years, multiple patients fell severely ill after their visits to Dr. Smith. They came seeking healing, but left with an unseen menace coursing through their veins. The disease was relentless, sparing no one it touched. It did not discriminate between age or health status. Some of these patients, tragically, succumbed to the disease, losing their lives to this unseen enemy. The hospital was thrown into a state of panic and confusion. Investigations were launched, but no one could trace the source of the infection. It was only when Dr. Smith himself fell ill that the horrifying truth came to light. The beloved physician, the healer, had unknowingly been the very source of the danger. This tale serves as a stark reminder of the hidden dangers that lurk in places where we least expect them. Even in the sterile, controlled environment of a hospital, where safety is paramount, a silent menace can thrive, turning a place of healing into a breeding ground for death. A healer turned unintentional harbinger of death, a grim reminder of the hidden dangers in hospitals. In the world of medicine, some discoveries can be as horrifying as they are shocking. Let's delve into the story of a surgeon who, during an ordinary day at work, stumbled upon a chilling secret. This surgeon, let's call him Dr. Johnson, was renowned for his meticulous approach. It was this very trait that led him to a discovery that would shake him to his core. Dr. Johnson was performing a routine checkup on a patient, a seemingly innocuous task. It was during this checkup that he noticed something unusual. The patient, recently discharged from surgery, had an unaccounted-for surgical scar. Puzzled, Dr. Johnson decided to investigate further. Upon reviewing the patient's medical records, he found no mention of any recent operative procedure. The scar, fresh and healing, was a silent testament to a surgery the patient was unaware of. A creeping sense of dread washed over Dr. Johnson as he began to connect the dots. His investigation led him to a horrifying conclusion. The hospital he had been serving for years, the place he considered a sanctuary of healing, was a front for a nefarious organ trafficking operation using unsuspecting patients as unwilling donors. His findings were met with disbelief and shock. The hospital staff, the patients, everyone was unwittingly part of a dark scheme. The very walls that were meant to safeguard health and life were instead housing an operation that exploited the vulnerable, stripping them of their most basic rights. Dr. Johnson took a stand, refusing to let this appalling discovery go unnoticed. He blew the whistle, exposing the operation and risking his career in the process. The fallout was massive, the ramifications echoing through the medical community and beyond. This story, as chilling as it is, serves as a stark reminder. Medicine, a field dedicated to healing and preserving life, can also harbor dark secrets. These secrets, when unearthed, can shake the very foundations of our belief in the sanctity of healthcare. A shocking revelation that exposes the dark underbelly of the medical world. Prescriptions are meant to heal, but in the wrong hands, they can be a deadly weapon. Our story unfolds in the heart of a bustling city hospital, where a doctor, cloaked in the trust and respect his profession bestows, conducts a horrifying experiment. This doctor, let's call him Dr. X, harbored a twisted curiosity that pushed him beyond the boundaries of ethics and humanity. Dr. X was not your average physician. He held an unusual fascination for the effects of lethal combinations of drugs, an interest that was far from academic. He saw his patients not as people in need of healing, but as test subjects for his macabre curiosity. It began subtly, with small changes in prescribed medications. A little more of this, a little less of that, a strange combination here, an unusual pairing there. The patients, placing their trust in the man in the white coat, swallowed these pills without question. As time went on, the outcomes of these prescriptions became increasingly dire. Patients would return with complaints of unusual symptoms, rapid deteriorations, and in some tragic cases, they did not return at all. Yet, through all this, Dr. X remained unfazed. His notes grew more detailed, his observations more thorough. His deadly experiment continued, unchecked. The truth behind his actions remained hidden, until a vigilant pharmacist noticed the unusual combinations of drugs being prescribed. With a growing sense of dread, she pieced together the horrific pattern. The lethal cocktails of drugs were not errors, but intentional prescriptions. The police were alerted, and Dr. X's reign of terror was brought to an abrupt end. This story is a chilling reminder of the trust we place in those who promise to heal us. It's a tale of a doctor who stepped over the line, who saw his patients as mere guinea pigs in his deadly game. His actions not only violated the trust of his patients, but shook the very foundation of medical ethics. A tale of malpractice that shows the horrifying extent of a doctor's betrayal. The trust between a doctor and patient is sacred, but what happens when that trust is shattered? In the world of medicine, there are few relationships as intimate as the one between a psychiatrist and their patient. This bond, hinged upon trust and confidentiality, is a lifeline for many. But what if instead of healing, this relationship is used as a weapon of manipulation? Our final tale is of a psychiatrist who didn't just shatter this trust, but pulverized it, leaving her patients in a state of bewildered agony. She wasn't just any psychiatrist. She was a master manipulator, a puppeteer who played with her patients' memories, causing them to question their own reality. Imagine, if you will, sitting in a plush chair, spilling your deepest fears and insecurities, only to have them twisted and turned against you. This was the reality for her unsuspecting patients. She used her position of trust to experiment, turning the sanctity of therapy into a twisted game of mind control. The results were catastrophic. Patients, once confident in their memories, now questioned every thought, every experience. Their reality, once solid and reliable, turned into a malleable plaything in the hands of a person they trusted. The fallout was immense, with a wave of confusion, paranoia, and mistrust sweeping over their lives. This psychiatrist, who was supposed to be a beacon of hope, became a symbol of betrayal. Her actions, far from the Hippocratic oath she swore to uphold, were a dark reminder of the power doctors wield and the chaos that can ensue when it's misused. In the end, the psychiatrist's devious practices were exposed, her license revoked, and she was held accountable for the damage she caused. But the scars she left on her patients' psyches were far deeper, a haunting reminder of the trust they once placed in her. A chilling reminder of the damage that can be done when the ones we trust use their power for harm.